He said, my name's Deborah Haynes. I am the head of Dorset Civil Contingencies Unit. And I've just come along this morning to talk a little bit about the Local Resilience Forum itself, how we work together as partner agencies and what we're trying to achieve. And basically, the approach that we take in the UK to emergency planning and keeping people safe. There we go. I was thinking the slides aren't moving, but they are. What I'm going to cover, I think I've got about 20-25 minutes this morning just to talk you through. I'm going to talk a bit about why we exist, and that goes back to the Civil Contingencies Act itself and the legislation that we work to, how the partnership is structured, how we formulate our work, how we look at the risks and write plans accordingly, what we do to come together in response and what that feels like, a bit about the lessons we learn, because what I've experienced in 20 years of doing this is every incident is different. And there is always something that you can improve on. And obviously that can be local. And obviously we have national incidents as well that we learn lessons from. That's a really important bit of what we do about getting better and better and improving our plans and the way we work. And just a little bit about the way the resilience picture might change in the future and what the government want from us and just the way we might be working as partners as we go forward. So starting, as I said, about why we exist in the first place and what actually is the Civil Contingencies Act. So obviously, partner agencies like police and fire services have worked together for years and years in responding to incidents and worked with other statutory agencies. But very early in the 2000s, there were a number of incidents which really tested the UK's response in ways that it hadn't really been tested before. We had things like, people can think back, they'll remember things like the foot and mouth crisis. We had a large scale strikes from our fire service. And if you don't remember, everything like green goddesses were brought out by the military to stand in. We had, gosh, I don't even want to mention the word fuel crisis with the way costs are at the moment, but there was a fuel crisis back at the beginning of 2000, which really impacted people. And lots of different things. And then things in other countries, things like 9/11, which really made the UK stop and think about what legislation that we had in place and if it was actually fit for purpose anymore for the kind of incidents and issues that we were being faced with now. So that was why they sort of thought, we need a new act. We need to think about who gets duties under that act. And it brought in several things that you can see on the slide in front of you. It standardized the way they were asking emergency services and others to work together. It gave birth basically to the Local Resilience Forum as it stands at the moment. We were actually asked to come together and create this Local Resilience Forum so that we were all sort of working in the same way. It defined what they thought we wanted to respond to, what actually is an emergency, anything that's putting pressure on the UK and is above our normal way of responding, really. It gave us duties, statutory duties on those members, and you'll see at the bottom it refers to Category 1 and Category 2 responders, and that is the people that the Civil Contingencies Act refers to. And I've got slides in a moment which will explain exactly who they are and what kind of duties they get. So talking of the duties, this is what we got. There's 7 of them. And there won't be any real surprises to you. The first thing it does is to say, as statutory organisations, you will cooperate and work together. It makes an awful lot of sense because who would want to respond by themselves? but it means it was really important that actually we support the services that each other deliver. It wanted us to ensure that we shared information. Really important again. If you think about the different types of information people like the police hold, what the local authority have got access to, really important in an incident. We might have vulnerable communities at risk and the police might go, I'm going to go knock on doors. Who do I need to prioritise here? And actually people like our health and social care colleagues will have lists of people who are known vulnerable that can be shared with the police and we can prioritise. Again, makes total sense. We were told to conduct risk assessments, to consider what issues we might face on a national basis and locally, and think about how we are prepared for those. We have a statutory duty to actually write plans and exercise and train those plans so that we, are ready to respond on the day. We have a duty to consider our own business continuity, and each of the partner agencies that the LRF works with are delivering essential services. So it's really important that those continue no matter what challenge we're faced with. So we have a duty to ensure that we can keep our own houses in order and keep running. We're discharging this one today, really, communicating with our public, telling them how we work, telling them about the risks, and really important to warn and inform you if something is going on so that you are aware and you've got that early indication. And the last one just sits with my lovely local authority colleagues, and that message that I said earlier about our business continuity, the local authorities have an additional duty, which is to share that advice and support for other local agencies and businesses. So they are a bit of a leader, and they will give information out to local businesses to help them and other critical services, because it's not just about us, is it? We rely on a lot of other people. If you think of something really important like a care home, making sure we support them with business continuity because they're delivering critical services themselves. That's really important duty that we support those in thinking about their business continuity as well. Just a bit about how we're structured. The decision was made that local resilience forums would be based on the police constabulary boundaries. You'll see on the map in front basically how that means we're split up around the southwest and some of our neighbours. It works well, and most cases, certainly around our southwest, our local resilience forum is chaired by our police. So Dorset Police is the chair of our LRF, so it makes sense that it's based around our boundary. But of course it means we're not always completely coterminous with agencies that need to sit around that table. I'm sure many of you are aware that our fire service is Wiltshire and Swindon, as well as Dorset and Wiltshire Fire and Rescue Service, and our ambulance service, Southwest Ambulance Service, covers Devon and Cornwall, Avon and Somerset, Gloucestershire, Wiltshire, as well as ourselves. So we do work with other partners that cover other areas, and a lot of our partners think people like the Environment Agency are national. So we have some very local Dorset agencies like our local authorities and Dorset Police, and other agencies cover large areas. But obviously incidents don't stop and recognise borders anyway. So it's really important that we speak to those other LRFs, particularly the ones that we border, to ensure that actually the way we work is completely seamless, and that we have conversations with those partners, and we do. Our local resilience forum chairs come together 3 times a year across the southwest. The next meeting is next week, and we look at issues that affect all of us to ensure that we've got our plans are in line and with each other. And also outside of the southwest, obviously Dorset, we sit on the edge. What's happening in Hampshire is important to me is what's happening in Wiltshire, Avon and Somerset and Devon and Cornwall. So I meet up with my colleagues from Hampshire and the southeast as well to make sure and say we keep those firm links in place. The LRF itself, to break it down, what it actually is. So the very bland definition, a multi-agency forum for responders to collectively plan and prepare with a purpose to ensure that we effectively deliver the duties of the Act. I think it goes a bit further from that for me personally. I think that effective duty delivery is probably the very basis of it. I think what we recognise is no statutory agency wants to be working alone when we're under the pressure of something like a major incident. We want to be effectively working with our colleagues, with our partners. If I can think of times when I've had incidents, as I said, every incident is different, and when you're called out to it, I think as human beings, every single one of us, I've been just over 20 years I've been doing this, and my pulse rate still goes up on the day that I can see that the police control room is ringing me, because I don't know what they're going to give, what message it's going to be. And the thing that brings my pulse rate down is the minute I phone one of my partner agencies who I already know, and someone like Nigel answers, and I've got that colleague there who I know, we've got a good relationship. He comes on, he's like, hi Deb, hi Nigel, and we can start working. It is the best way to actually bring it together, and you've got trusted people that you know you can work with. So it may be a requirement, but we do it gladly. So yes, we're required by the Act. I've talked about the boundaries. One of the interesting things, is what exactly we are. The LRF itself is not a legal entity. We have no statutory standing. We can't be. If you, in very basics, we're a partnership meeting. The statutory responsibility has to sit with those individual partner agencies. So the LRF has no directive membership. I talked about the police sit in the chairmanship, but it is around mutual and collective decision making. We don't sit there and tell agencies what they should be doing. Those agencies are statutory agencies with their own legislation and their own responsibilities in their own right. What it does do is coordinate. And we get really good representation from our statutory agencies in Dorset, and at an executive and a practitioner level. And that's pretty much, ours is chaired by our chief constable, does not delegate it down lower. Our local authority representatives are our chief executives. We take it very seriously. It's one of the most important things we do, and it gets that recognition from our Dorset partners, I'm pleased to say. So the partners, they are exactly probably who you would expect them to be. And these are our category one, the one that have all of those, that list that I put up, those 7 responsibilities, with the 8th one on our local authorities. It's the blue light services that I've referred to the Environment Agency. It's our 2 local authorities. It's the Maritime Coast Guard, British Transport Police. And we've put NHS. NHS obviously is not as simple as one agency. UK Health Security Agency come in there by themselves. They came in last year, used to be Public Health England. NHS is obviously broken up of lots of different organisations. NHS England, the Clinical Commissioning Group, and all of our hospitals. And they're all category 1 in their own right. The only one that currently isn't is the Clinical Commissioning Group, but I'll come back to them in my next slide. But every sort of arm of the NHS has a category 1 duty on it. And what we tend to have is NHS England and our Clinical Commissioning Group representing the wider NHS at our meetings, although quite often in response we have representatives from our hospital sitting there. They are full members and they can always join us, and we always welcome them. So the other category I talked about was category 2. So they don't have those 7 duties placed upon them. They have 2, but they are really important, and that's the cooperation and the information sharing. So before the CCA, obviously, if you can think of things that might affect us, it's really often issues with our transportation system, it's issues that affect our utilities, critical national infrastructure that we work with. So what the CCA gave a duty on those organisations that they had to work with their LRFs. So if you think just over 2 weeks ago to Storm Eunice, how closely we needed to work with Scottish and Southern Electric and Western Power. Really important that those agencies joined our meetings to give us updates on what was happening, who was out of power, where did we need to put in support. And our category twos are really strong in supporting us and attend many of our meetings. And so many of the incidents that we have on our plans need to include those organisations. I mentioned clinical commissioning groups and said I would come back to them. So at the moment, interestingly, clinical commissioning groups are officially a category two. They've never acted like a category two. They place on themselves the duties of a category one, and they sit around our LRF tables routinely at the moment. Interestingly, NHS does like to reorganise very often. They'd be the first to admit it. And you may be aware that clinical commissioning groups are being phased out this year and being replaced with integrated care boards, bringing health and social care closer together. And those integrated care boards, which are due to come in July, I believe, are actually going to be category one. So they've recognised themselves, and it's been recognised nationally, that actually they play a really important role. They coordinate our local health services. So that's a really positive change. And then there's other people that actually don't fall under a category at all, but still really important. And that's people like our military, which sit around our LRF table, even though they're not a responder. The Met Office, again, really important close links with them. They always join our meetings as well, and knowing how the weather's affecting us allows us to plan ahead when we get large storms, etc. Government liaison comes through the Ministry of Housing, Communities and Local Government, their Resilience and Emergencies Division. We have a local coordinator who joins our meetings and ensures that we get messages down from government, and we've got a conduit back in. There's also national agencies like APHA and voluntary agencies, a massive important part. Now, a lot of people would argue, and voluntary agencies themselves argued when the CCA first came in, that they thought they should be in the Act. But actually, it's really unfair to put a statutory duty on what is, in fact, a voluntary organisation. But what the Act does recommend to us as statutory partners is that we should work with our voluntary agencies, and we take that really seriously in Dorset. And we have an excellent, I think some people, if they were here earlier in the week, will have seen a fantastic presentation by Matt Reeve, who's our voluntary agencies chair. And Matt is a vital member of our executive. And does a sterling job in bringing us together with all our voluntary agencies. We know we can't work without them, so they are embedded in all of our plans and training. A bit about how we make it work. This is a very simplified structure. At the top, we've got our LRF executive, which I've mentioned previously, chaired by that chief constable, and with executive level representation from those agencies that I've shared. They give us our strategic direction, tell us what we should be doing, and keep a wary assurance eye about the resilient state of Dorset. Underneath that, we have a business management group, and that's where people like myself and Nigel and others will come together and discharge the duties and make sure the work gets done, write the plans, hold the training and exercising events, so that we can make sure we are as prepared as possible. We have a sister organisation, which is the Local Health Resilience Partnership. And I've mentioned, obviously, health is a very large and complex, so they have their own sister group that works alongside our executive to pick up where the health particularly needs to lead. And they can do their own plans, sometimes their own plans just for health, and sometimes they write plans on behalf of us as the LRF, because they might have an obvious, things like a pandemic plan, interestingly, which obviously has got a lot of use recently, can be led by our LHRP colleagues. And I still sit on that group, and many LRF colleagues do. We really do work with them as a sister branch. And then in the middle of that circle, you will see a wonderful acronym DPOW. That stands for Dorset Prepared on Wednesdays. The reason for that acronym is on the first Wednesday of every month, those practitioners come together to make sure we hold a day in our diary, because everybody's busy. They've all got other jobs. They're all looking back in their partners, internally in their agencies. But that first Wednesday, we keep free to work together as a partnership and check where we are, and have subgroups that look at all the various issues that we might want to deal with. And some of those are around that outside. I've talked about we have a specific group that looks about voluntary agencies, one that's looking at our risks and our assessments and our capability to respond. We meet regularly with those category twos that I was talking about, those utility companies and transport organisations. We feed in with those separately. Our warning and informing, our communications leads come together, because obviously we have that duty to warning and inform the public. So we get our communications lead, they know each other, they're used to working together, so that we can make sure we get the right people sending the right messages out. I've talked about training and exercising and putting those things in the calendar. And because it's such a big risk, we have specific groups like severe weather, which actually meet ahead of summer to go, what we know what that brings challenges, and then in the autumn, are we ready for this winter? And because we know this is obviously a challenge that's going to come every year. And all of those groups come together and we follow everything on that Wednesday. But so we'd like to say Dorset is prepared on every day of the week, not just on a Wednesday, but that's certainly when we meet to talk about it. And just quickly, what do we do? Some LRFs are set up quite differently. They don't always have the chief constable in the chair. It can be different people in some counties and LRFs in the country. It can be a chief fire officer who's chairing. We've got a civil contingencies unit in Dorset. Some people have an LRF manager and it's a couple of people, an assistant. We have a small unit actually, which gives us a 24/7 capability to respond. That's how we how we decide to do it in Dorset, and it works for us. But no matter how you're set up, every LRF actually has the same goal, where they've all got to do the same thing. They've got to assess those risks, they've got to write the plans, they've got to put training and exercising together, and they've got to respond. And I say the partnership and building the relationship is probably the most important thing that we do on there. Risk assessment. I've mentioned that we do this. How do we do it? Well, we start with the National Risk Register that comes out from the government. They send us a national security risk assessment. You see the matrix on the screen. I don't expect you to try and read it, but you'll see how it breaks it down into green, yellow, amber, red. And we'll have top major risk in the country. Interestingly, a lot of people knew that our top risk was a pandemic. We've proved that one very correct, obviously. But major flooding, things like that sit in that red area. And then there's all the different things that we could be faced with. We look at what's the likelihood of them happening and what's the impact if they do. And that's where then it falls on that matrix. And we can commit our resources according to that and think about our preparedness for all of those issues. We don't just do what gets sent from us nationally. We also look at what we've got in Dorset, and we will add that onto our community risk register, because we will be aware of what we've got locally. So something like Poole Harbour and associated risks with that. You think about what you have in your local area as well as what the national will give us, and that gives us our assessment for Dorset LRF. So take that register. So we look at it and we try to identify gaps and go, where do we think we're not prepared? Where have we not trained? What risk have we not looked at for a long time? What do we want to improve? And that's how we apportion our work and write our plans. And they're all going to bounce in, and there's a lot of them. And this is not all of them. But there are certain things that we will write specific plans for, and there are other things which are generic, which is how we just start and respond. But whenever we feel like we have a gap, we really think about writing a plan and testing it so that we are prepared for that risk. And then sometimes things do go wrong and we really have to come together. And that's an interesting time. And we do that by looking at our command, control and coordination. We work to a national format, which basically is 3 levels. That strategic level. And you say here it's the thinkers, the people that are going to decide what we're going to do. And that's those executives that I was talking about earlier that sit on that LRF executive. These are the people that can spend money, commit resources, set the goal. This is what we're going to do. And yes, we're going to throw money, and we have the people in order to do it. And then you have that tactical sitting in the middle, and that's probably where Nigel and I are sitting. And we're coming together. We've listened to what the strategy's been set. And how are we going to do it? This is what the strategic people want us to do. How do we do it? What do we need in order to do it? If we're evacuating, okay, well, what do we need to it? Well, we need to tell people we need buses and transport. We need somewhere for these people to go. That's the tactical. And then operational are the people that you'll recognise. They're the doers. They're the frontline emergency responders. They are the people that will knock on your door when we want to evacuate you. They're the people that will greet you. They are the healthcare providers. They are the people on the ground. I'm not I don't really know my football analogies, but I'm sure a lot of people in Iris will understand it. But you can think about it as the strategic, the tactical and the operational, and how they will think about it. What we're setting out to do, how we're going to do it, and the people that actually deliver to ensure that we do deliver it on the day. A bit about how we command and control. And I mentioned earlier, didn't I, about the LRF isn't statutory. No, we're not. And we don't control. We don't actually tell other people what they're going to do with their resources. That's command, and that works down. If single agencies retain command of their own staff in an emergency, they could direct their own resources. What the multi-agency ensures we do is the control and that coordination piece, so that everybody else knows what everybody is doing and that what we're deciding to do works together. I apologise for cantering through, but I'm keeping an eye on the time. I'll be chased up by Nigel. And one thing we do work to is a national principle system. It's called JESSP, Joint Emergency Services Interoperability Principles. And they've been brought in the last sort of 5 to 6 years from learning from other large scale incidents, which ensure that we look at things like when there's an emergency scene, actually our blue lights, they co-locate, they go to the same location so that they can talk and coordinate together, and that everybody knows exactly what is going on and what the level of risk is. If you don't understand the risk together, you might be not making the best decisions. You might not be deploying your resources in the right way. And the decision making is really important. And the other part that we live by in most of our documents, and all of our agendas are written around this, is this thing called a joint decision model, which means we go through the right steps to decide what we're going to do in an incident. And it's about gathering all that intelligence, getting that all together and going, what's the risk then? What do we need to do? And then powers and policies and procedures. What's in my toolbox to respond to this? Okay, this is the problem. How can I respond to it? From that, knowing the plans that we've got, knowing the procedures that we've tested, let's identify some options and get out there and do it. And then you go round again, meet up again. What happened? Where are we now? And keep going round it. And that means that actually you are always coming together. You're never forgetting to do a step, and you get better decisions. At the end, you can't just go away for tea and biscuits. There's usually some recovery needed. And when the blue lights have maybe finished on scene, they will pass the responsibility of recovery over to our local authorities, because incidents don't just stop because the weather's stopped. People might be out of their homes. Things have been damaged. Has the environment been damaged? Is there infrastructure that needs clearing up? Has this been really difficult for people? Are there more mental health needs now? Do people need advice on insurance? Have they been flooded? So we don't just walk away. There is a whole part of our planning and part of our preparedness is about that recovery. We are there right to the end of that road, and that can go on for months and years. And we recognise that, and we still continue to meet and prepare for that recovery area. And while we're recovering and while we're getting to the end of it, we then look back. And I talked about at the beginning, it's really important that we don't just walk away and go, good job, everybody. We stop and we debrief and go, how do we think we did? We have sessions after all of our meetings. I've talked about Storm Eunice a few times. That debrief will come together, and we'll be honest with ourselves and hold that mirror up and go, what did we feel we did right? And what did we feel we could have done better on? What's the impact of what we did? and we learn the lessons from what happens in other places when those inquiries come out. We don't just, we take those documents and we go through them and we write our own objectives and our own actions based on what we're learning from other people, so that we can continuously improve, because nobody wants to repeat mistakes that have been made in the past. And then finally, from me, just a bit about what's happening next. And I mentioned earlier that resilience is taken very seriously. It's taken very seriously by us. And if anything, I would say our COVID experience has really put local resilience forums in the front of the national picture. And we've realised actually we play a very important role. So the Civil Contingencies Act, which I've mentioned all the way through, it gets regularly reviewed, and it's being reviewed right now. In fact, the end of March, we are due for a refresh of the Civil Contingencies Act, and that's why they can bring in that change around integrated care boards. But they are looking at the duties, they are looking about who it applies to, and it's being updated to make sure it's fit for purpose for the next 20 years. We know Michael Gove's there because he's just become the Minister for Department for Levelling Up Housing and Communities. Really important that he's setting the future for what they want from resilience. We don't get core funding. We are funded by the partners that are in there. That's being questioned and actually going, if we're doing such an important role, if you want us to do more, this needs to be recognised. And there is a vision that they want to make the UK the most resilient nation. Quite a difficult challenge. I think we need to take our populations with us if we're going to do that. And actually, what we're doing this week, community resilience, is right at the top of that agenda, because they recognise actually statutory agencies in no way could do this by themselves. This is about individual resilience and collective resilience being actually all the different parts that are required. If we're going to get near that vision, that's what we'll need to put in place. I'm sorry for my speed and my cantering through, but I have made it through, and I'm a little bit over time, but not too bad, Nigel. So hopefully I'm not in trouble.